Well, the First Minister of Wales, Mark Drakeford, joins us now. Timing is everything, as the Prisons Minister was telling us there, Mr Drakeford. And we're expecting an announcement from you today about the lifting of lockdown restrictions in Wales, or not, as the case may be. Just tell us, what is the current situation there?
Well, there's grounds for optimism in Wales at the moment. The number of people suffering from coronavirus is declining every day. Not low enough. There's further ground to gain. The numbers in our hospitals are stubbornly high, but just beginning to decline. I'm going to have to explain today that the current lockdown measures will need to continue for a further 3 weeks in order to build on the progress we've made so far, but with some plans beyond that to begin the lifting of the lockdown.
And so you're, my understanding, looking at reopening schools from the 22nd of February, the week after half-term?
Well, schools are our top priority. If there's any headroom after the next 3 weeks, we will use it to begin a phased and flexible return of our young people to face-to-face learning. Children and young people have had an absolutely torrid time over the last 12 months, and our cabinet is determined that they will have priority when it comes to be able to begin the lifting of the lockdown. We'll work hard with our local education authorities and trade unions over the next week to plan for that. It won't be every child by any means back in the classroom, but we can begin that process after the 22nd of February, provided the numbers continue to move in the right direction.
What about vaccinating teachers? Would that be a good idea, vaccinating them?
Well, we follow the advice of the Joint Committee on Vaccination and Immunisation. They look all the time at the priority groups. If they tell us that we should move teachers or other professional groups up the priority order, that is what we will do. At the moment, their advice is that we should stick with the 9 priority groups they've identified at the outset. We will follow the best advice available in the United Kingdom, and if that advice would change, then we would change with it.
Why is it that Wales has missed its vaccine targets when they seem to have gone relatively smoothly around England? You were supposed to have got to 70% of the over 80s by the weekend, but you haven't. Why?
Well, we just missed it at the weekend because we had a weekend of snow, flooding and ice in many parts of Wales. I'm confident we will have reached that during the week as we caught up on the appointments that people over 80 were simply unable to attend because they couldn't leave their homes because of weather conditions.
But there are other critics who sorry, we're slightly limited in time, but there are other critics who say that you slowed down the role of the Pfizer vaccine. Why did you do that initially? Wouldn't that have had an impact?
Well, we didn't do it. That is simply not true. We are using every drop of vaccine that we have, whether that's Pfizer or the Oxford vaccine. We will have vaccinated a higher proportion of our population in the last 7 days than any other part of the United Kingdom. But the race is not with other countries. The race is with the virus, a race between infection and injection. And we are on track in Wales to deliver what we promised. The top 4 priority groups will all have been offered vaccination by the middle of February. We have 400 GP practices now involved in the vaccination effort here in Wales. It's a huge success story and one which people should be proud of.
Do you have an issue with vaccine supplies? You know, Nicola Sturgeon has talked about possibly releasing information about the vaccine supplies being offered to Scotland. Is that an issue and something you would maybe do as well?
Well, the thing that limits our ability to vaccinate more people at the moment is supply, but that's true everywhere. In the United Kingdom, if we had more of the vaccine, we would be able to vaccinate more people. It's why today's announcement of a 4th vaccine going to the regulator for approval is good news.
So you don't think actually publishing any kind of figures is particularly useful?
Well, we were about to publish figures here in Wales. We publish more data than would be the case across our border in England. We were asked not to by the UK government. There's a lot of sensitivity at the moment, as you know, across the whole of Europe about supplies of vaccine. While the UK government tells us that it would not be sensible, we will take that advice seriously. We're not going to publish it at the moment. As soon as it's safe to do so and right to do so, we will put that information into the public domain.
OK, Mark Drakeford, good to talk to you. Thank you very much.